My name is Ishmael Patel. I am the manager of Filey Care and Support. We are an established provider of supported living accommodation services in the borough of Enfield and Luton. We rehabilitate people with the following diagnosis and conditions: paranoid schizophrenia, forensics, clients under section 3741, learning disabilities, personality disorders, challenging behaviour. We also work with medically complex clients with severe comorbid conditions. Our units accommodate up to 6 clients and are located in residential areas as part of the local community. By having smaller units, this allows the clients to be supported in a more holistic, person-centered approach. We aim to better the lives of all our clients by promoting choice, dignity, confidentiality, respect and independence. We also ensure that all our clients feel safe and secure in their own home and when they are accessing the community. Some other area we focus on are working closely with families, friends and other mental health professionals to provide a better quality of care. We also support them with appointments, help and maintain daily living skills. For example, each unit supports all clients with fresh home-cooked meals through group cooking sessions which promotes healthy living. We also engage clients in activities, giving them weekly structure and routine. We also help develop clients to obtain independence and in time support them moving down to semi-support and eventually independent living. Our staff are very skilled, qualified, experienced and passionate. The majority of our staff have worked for Filey Care for several years. This has allowed for strong bonding relationships to be built with our clients with boundaries in place.
My name is Elizabeth. I was diagnosed about 2 years ago with diabetes. I was in hospital for quite a while with that. I have a disability on my right forearm as well called club hand, and I have a moderate learning difficulty, but I've not been properly diagnosed.
So I was pretty used to doing nothing. I didn't have to do any laundry, any cooking, any washing, cleaning. So when I first came here, I was pretty much dependent on the staff for everything. Even kind of reminded me to take a shower and change my clothes and that.
I'm Duncan Jeffrey, paranoid schizophrenia and mild learning disability. Personal care, cooking, laundry, and just keeping my bedroom clean and tidy. Daily walks, shopping, exercise class, cooking, baking. All I would like to say is thank you for everything you've done for me.
I wouldn't say for it to be done myself. I could do some of it myself, but then take it to a member of staff for them to have a look. I'd like to say a huge thank you. They've been very helpful and they really helped me.
Oh, why are you crying?
Why are you crying?
Yes, I'm Jody. I've been with Filey Care and Support for 4 years almost. A couple of months it will be 4 years. When I first came here, I came with experience, not so much with mental health side, but I had experience somewhat in that area. And being with Filey Care, it has really settled me in to fall in love with this side of caring and meeting all these clients, each and every one who you have spoken to just now. I've had a big role in their care, and I've been key workers, I've been co-key workers to most of them. We've developed a very close bond in a way where they can come and they can speak with me openly and honestly, and they will guarantee that they'll get the support and the care they need.
Stephen.
Stephen has Down syndrome, not at the higher end of the spectrum. He also has ADHD.
Yep.
He has several medical issues, like he has rosacea, he has celiac disease. He also is on a gluten-free diet since 2017, so that's almost 4 years or 4 years. Say Filey.
Filey.
Care.
Okay, yeah.
And support.
Cook, yeah.
Well done.
What do I cook for you?
Cake.
Cake and
Yeah.
what do you like best? Curry.
Right.
On my first starting here as a staff, Stephen had his speech impediment wasn't overly bad, but you could not understand some of what he said, and it took a moment for him to speak. But over the years, he has really improved by leaps and bounds. He's speaking more clearly, sentences are put together properly, and he can converse with anyone here, staff as well as other service users, and he can answer some questions. And knowing Stephen, then if it's not properly explained, then you'd know what he means. But he has truly improved in a lot of areas. He has his little pranks that he does, but even those are really cut down on a level. He's a challenging client, but with all staff support and management and everyone who works under Filey Care, we really manages him. And his parents, they are very, very, very pleased. And they have no issue with any of his care, none at all, because they see where he too has improved, and they always tells us that they really, really like him being here as a client, you know, yes.
My name is Erkan. I have a LD and mental health and disability. Filey Care and Support, about 5 years. One, I learned my lesson because of the incident. Since I came here, there was no problem, not with one issue from now, and I don't think it will be never again. I would shower with the sponge and brush my teeth, get dressed every day. I don't wear one t-shirt, I don't wear 2 days. Every day I change it. I'll cook more food. Some foods I will need help.
But when you came here, you couldn't wash your clothes
I couldn't do nothing.
So you've improved on washing your clothes and your personal hygiene. And cooking, you're slowly getting there, am I right?
Yes.
My name's Max Rose, schizophrenia, ADHD, nothing else. Filey Care and Support, 3.5 years. Everything, showering, cleaning my room, cleaning my clothes. I've improved my personal hygiene. Yeah, I go to work at a charity shop, I go to college, IT.
My name is Joan Mattis, I'm the team supervisor. The service we provide for this client is really great, it's fantastic. We have taught them a lot of stuff, them key working skills, how to become semi-independent, and you can actually see the difference in them where, you know, where they were and where they are now. And they thoroughly enjoy being together as a unit, yeah, and they know that we are there for them 100% for them. We support them in every avenue of their life. We promote them. At the moment, there's one when I first started, he wasn't good in his English and math, and he's now decided that he's going to go to uni. So, and that's come with a lot of support throughout what we've offered to him. For us to get to the success we are now, we took the time out to understand our client. We work with our client, yeah. We worked as a unit. We know their trigger points, yeah, when to talk, when not to talk, when they need loving, when they don't need loving, yeah. So that is where it's like a mother nature when you're nourishing your children and you're teaching them things. So that's how, and it's a lot about trust as well. We had to build their trust. We had to make sure that they know that they can rely on us, yeah, and we would support them throughout everything. Yes, they do have down life, but as you can see, yeah, I always believe in positive, yeah, and I talk positive. We all talk positive to the clients, yeah, so, you know, and this is what builds up their spirit, and this is what makes them believe in themselves. You've got to learn to love yourself first, yeah, yeah. Everybody's got the ability to do anything they want in their life, regardless where you come from and what you're going through. You've got to believe in yourself, and this is what we introduced into this unit, and this is why it's such a happy unit. As you can see, they gel together. We discuss things. We sit down, we discuss things, we talk about things, how we can make changes, how we can implement things. They have a lot of input. We listen to them, yeah, because as I said, we're a family. Agree? Every Monday we do our weekly planner. This is to give them structure, this is to give them routine. However, as I explained to them, yeah, on that day they might change their mind, but that gives them something to get up and go for. Yeah, so we do the weekly planner. Yeah, every 2 weeks we do the health and safety check. Yeah, before I do anything, I've always give them notice so that they're prepared and so they know that we're coming in and we're going to do that. And we sit down and we talk about things. Is there anything? We also do the monthly report, the weekly report. That gives us as staff a guideline of what's going on. Yeah, so anybody what comes into our unit will be able to can read up on the client and follow up. Even if you're not unable to tell them, it's quite clear for everybody to understand. Yeah, yes, there is a lot of paperwork, but I do make sure the clients fully understand what we're doing. I always make sure they agree to it. Yeah, it's vital. So when I'm saying to them and I'm talking to them, for me to know that they fully understand, I ask them for a feedback. So when you get feedback, that's when you know that they understand what's going on. They've got their rights and we need to respect them.
Attachment Bunsu, personality disorder, and mild learning disability. Filey Care and Support. Because these staff care for me a lot, and the other providers let me do what I want. I approve it with personal hygiene, but I still got health and stuff. I approve in my laundry. Thank you for looking after me and helping me with my support.
I'm Catherine Ann Healy. I've got emotionally unstable personality disorder, ADHD and depression and that. It's losing people, being so low, not doing that much stuff. Filey Care and Support. Helping you with some certain stuff, making sure you take your medication. They take me out to shopping. I would like to be a support worker in mental health. I think that would be good for someone that has mental health to be a support worker and help people with mental health. I want to say thank you for helping me with everything.
My name's Sahid, I'm 19. I've got psychosis, anxiety, depression, brain damage. I got memory loss. Yeah, I'm more independent. I like living on here. Yeah. It's like living on your own. Yeah. You forget living with your parents and that. Okay. They help me with cooking. My aim in life is to be able to live my own, without no help, without supported living, to get my own flat. I want to live on my own. No, because if I had £1,000, I'd spend it in a day, you know that. I'll blow it in one day.
My name is Victoria Louise Kane. Depression, stress, anxiety, bipolar and schizophrenia. I lived at Bowles Court. The walls were dirty. The staff used to sit in the office, they didn't bother. When I smash things, they like to provoke me. I have anger issues, obviously. And where I try not to smash things or hit stuff, I would say it's a lot better. I think this place does help me a lot. My benefits, cooking, anything I want, money, budgeting. Yeah. Even though I get angry with them and have my little blips, they do help me. So, yeah. I had an idea work in not work, but voluntary, walk dogs, and then maybe in a little while to work with old people, voluntary, because I've got a lot of love for elderly people, because I'm a nan. Anger management, I need anger management counselling to do with my past. I had a very bad childhood. I wasn't well. Even though I'm not well now, hopefully I will get better. I think the staff are lovely and I just want to say thank you for everything they've done. I feel appreciated.
My name is Michael Mbaneme. I'm a support worker. I work for Filey Care and Support. I'm working here since November. It's quite good working with the company and then with the client as well. I mean, it's a job I wanted to do, and and I'm happy to do it. So I have this impression, I have this thing to care for people, to look out for people, because when I was in school, my secondary school days, I was, we call it infirmary. I was the infirmarian of my school for 5 years. So I've had that mindset or that feelings that to help people, care for people, even mentally, even wounded people, all those stuff. So that is why when I came here, I'm happy to see that kind of job and then key into that as well. I've had like 4 years experience, going to 3 years and now experience in this field. In the sense that any of them can come, we give them, maybe help them in doing the activities, encourage them to take their medications, like someone like Vicky. It's an example, someone I'm picking names, but encourage them and then to help them to live more independently in the community tomorrow, because this is where they live now, but tomorrow they are aiming to live by their own tomorrow, to have their own houses or other things to live and do things by themselves as well.
So what?
Cooking section, encourage them to do their washing, like do the cleanings as well, and games as well, which one of them is keen to, and obviously we're gonna start doing that as soon as possible. And then lastly, in my own mindsets, thank you for the company for choosing me and then to allow me to work for you guys. It's sort of a dream come true. I've heard of you guys before, but then I fought for it, and then here I am now working with you guys. And I pray that you guys continue your good works, not only on Michael, but in all my colleagues as well and other people as well, at least to see our potentials brighten them more and more.
My name is Ridwan Kwazi. I'm a support worker in Filey Care, Dunstable. Every day is a different day. So in terms of administering medication to supporting clients and everything. So with the clients on a daily basis, you learn new things every day. So from that 1 year, I know it's a short period, but you learn so much from that. So on a daily basis, administering medication, and then maybe if they want to cook some lunch or something, or dinner, or cleaning, so we support them with those things. Yes, we do give a lot of support towards the clients and everything. On a daily basis, depending on what they want to do, we will try to cater towards them, towards that. Yes, I get enough support, so whenever we're in situations with clients or anything like that, or any advice, management is always there. I'm just glad that I'm here, and love working for the team, have amazing managers all around. So yeah, the support is 100% there. It's just amazing working here.
My name is Walter Suarez. I work for Filey Care and I'm supervisor at 210 Dunstable Road. I basically look after the people within the unit. I manage the unit, I manage the staff, customers, make sure everything's up to regulation, make sure everyone's fine and happy. So we support the individuals who live here to basically live independent lives. We support them to take their medication, we prompt them, we support them to go out into the community to do activities, and of course we support them with activities within the home as well. There is one service user who lives here who enjoys cooking and things like that, but she doesn't have the motivation to do it herself. She's down quite a lot of the time. With our support and our consistent support and our consistent prompting and just reassuring her that it will be okay and we can help her, we can support her through it. She manages to do it quite often now. We try to set up like baking days where we do baking with her and just general cooking. We encourage our service users and support them if they need it to do activities within the home, such as cooking. We have movie nights. In the summer, if we can, we do things like barbecues, and we just try and encourage them to stay active and to do things. So I have about six years, just over 6 years of experience within social care. I've worked with a variety of different types of people, from people with mental illness to learning disabilities, autism, physical disabilities. I've worked in supported living. I've worked in the domiciliary care, end-of-life care, nursing homes and day centres. So I have a lot of experience working with a lot of different customers and with lots of different professionals. What I like about Filey Care is their ethos and the whole company culture is really all centred around person-centred support. And that's something that's very rare to find these days, and I really appreciate and like that.
Hello, my name is Stan Ezioke. I'm one of the managers at Filey Care and Support Limited in Luton and then in London as well. So Filey Care and Support is a supported living environment that provides a residence and accommodation and support for people, adults with a learning disability and mental health condition. So we provide this support with the key important things like person-centered care. We deliver person-centered care to all our service users, and we ensure that this is done by providing a good support from the staffs to manage the service users' needs and care. We also try to promote independence within the organization. So we provide this independence and with the thought of having respecting the service user's dignity and choice, respecting the privacy as well, and ensuring that the needs are being met. So with regards to person-centered care, our team of staffs do provide a one-to-one section with each service users on a regular basis to be able to identify their needs and be able to support them with their individual needs. As a manager, I do support my staff as well with supervisions, regular supervisions and staff meeting. As a manager, I have got an experience with training. I've been in the industry, in the health and social care industry for nearly 20 years now. I started as a health care and support worker. Then I worked through myself into being a care coordinator and then mainly as a trainer, delivering mandatory trainings to health and social care workers. And that's what we do here all the time. In order to make sure that our staffs are competent and able to provide a quality service to our service users. So in order to make sure that the services are safe and that the carers are well competent, so we do competent assessment as well to make sure that everybody is competent and confident with their current job role in supporting people with learning disability and mental health. We mainly focus in having a small unit of about 5 to 6 residents in a unit because we believe in providing quality care rather than quantity, and then our services is well supported on a one-to-one basis and promoting the person-centered care that we're talking about. Our services we also ensure that they are well safeguarded. So we work with other professionals like the CQC, we work with the GPs, the services GP. We also work with psychiatrists and social workers as well in order to meet these service users' needs. And we also work very hand in hand with the service users' family, because one of the things that we also do is to encourage the service users with rehabilitation. So we work with them and support them with their everyday, day-to-day activities. So some of this might be taking the service user to shopping, it might be helping the service user with their financial needs like budgeting of their money, and we also provide them with, support them with different appointments. It could be a doctor's appointment, it could actually be planning for their life. Some of our service users might want to continue with education, and we support them to get them enrolled into a college or in a university of their choice, doing what they're actually like to do. This is Filey Care for You, and we mainly aim to ensure that our service users are well comfortable and well safe in the delivery of the care that we do provide for them, and the support as well that we do provide for them. So with Filey Care, we do have a team of directors. We do also engage the service users with a lot of activities of their choice. Some of them do activities like cooking activities, some of them do drawing, and some of them do play music, so instruments, musical instruments, and we do support and encourage them to do this. Some of them also, some of our service users also would like to engage with other day-to-day buying and selling of goods. So we also do support them with regards to working as a retail, for example. It could also be providing assistance with personal care. We also support them with assistance with personal care to be able to promote their hygiene needs. So this is basically what Filey Care is. We mainly aim to ensure that the quality of service that we provide for our service user is up to standard and within the CQC regulated requirements and within the health and social care requirements. We also comply with quality assurance as well, making sure that everything, every support that we provide for our service user is up to high standard, because in Filey Care we mainly aimed to create a family-oriented environment. A family-oriented environment is going to make our service user to feel at home while they live within our community. So we have a family-oriented environment where people are being looked after. They feel like they're in their own home, but most importantly is that they feel as independent as possible while they're living in any of our units. Thank you very much, and thank you. Filey Care is a home for everyone, and I look forward to seeing you, and thank you very much for listening. Thank you.